Why do you think that awareness of Marfan syndrome is important, awareness amongst medical professionals as well as the public?
A huge amount has been learned about Marfan syndrome in the last 20 years. Vast amounts. Not only do we now know the gene that the abnormality that causes it in most people, we know that there's certain conditions that look like Marfan's that respond in a slightly different way, that are not Marfan's, and that early treatment does play a major role in preventing catastrophic outcomes. And that treatment may be medicines or it may be surgery. So I think it's important that patients are seen by a cardiologist or a cardiology team who are aware of these new interventions and new treatments and the importance of early diagnosis. And also aware of the family aspect. So if you see one patient with Marfan syndrome, you don't stop there. You then make sure the rest of the family members are assessed. And that's not what most doctors do. Most doctors deal with the patient in front of them. So it's really, really important that Marfan patients are seen in specialist centres where they're familiar with dealing with Marfan syndrome. They know when to intervene and how to intervene.